Hey guys, Shadow the Rat, and for today's video, I wanted to talk about something that I mentioned in my last video, and that is the umbilical hernia surgery that my new rat Toast went through. So before I got Toast, the breeder told me that she had a strange lump on her belly, and she thought it was either an umbilical hernia or an umbilical abscess, and she hadn't dealt with either before, and neither had I, so she pretty much told me I could either have the babies refunded and go somewhere else, or I could have Toast swapped for another baby, in which case, when another dwarf female came of age, she would be bonded with the other rat, Butter, and then I would get them. Or the final option was for me to seek information from other breeders, other pet owners, and my vets, and see what they say, and then take home the baby and do whatever was necessary. With the condition there being that if Toast ended up needing surgery, she would refund me for both baby rats. So that refund would be about $100. And I decided that I wanted to go with option 3 because I had been watching Toast grow up, and on top of that, I also have a really good vet who is really experienced with rats, and I've taken many of my rats to them, so I feel very confident that they would be able to do what's necessary, and I just feel like it's better for a rat who has some sort of medical issue up front to go to someone who has those resources available rather than a new owner, although of course we all have to start somewhere, but you know, it's just easier if when you're starting out with a healthy pet. Anyways, so I took Toast home, and 2 days after I got her, I took her to the vet, and my vet told me that yes, it was an umbilical hernia, and that it would need to be surgically repaired, most likely because it was quite large compared to Toast's size. Typically, my vet tells me that these hernias will usually repair themselves within the first few days or weeks of life. The way they happen is that the mother rat, when nibbling off the umbilical cord after a baby is born, sometimes the mom might be too rough, and if they're too rough with nibbling off the umbilical cord, they can tear the abdominal wall, which is what leads to these umbilical hernias. And like I said, I was talking with my vet, and she tells me that a lot of people often do leave these hernias if they're small enough for 2 reasons. First of all, the hernia might repair itself. Oftentimes you have up until around 6 to 8 months for the hernia to repair itself, because that's when the rats will have done most of their growing. So sometimes these umbilical hernias will repair themselves at a later date, but it does get a lot less likely after you pass a few weeks of age because the rat is not growing as rapidly anymore. And the other reason people might not have these hernias repaired is because they're often very small, and so they don't really pose a big risk. However, if they do start to get larger, or if you're dealing with a fairly large one from the start, then it can be a pretty risky thing to leave it, in which case you would want to get surgery. So my vet told me that considering that my rat in this case is a dwarf rat, so she's already grown as much as she's going to, and that the hernia is already pretty big and it was actually getting a little bit bigger each week, it would be best to have it surgically fixed. So we did decide on a date to have it surgically fixed. Basically what they were going to do is just cut open the skin, push the innards back into the body, and then suture the outside so that the abdominal wall has a chance to heal. And that's exactly what they did. I mean, it took them pretty much no time to do the surgery. It was very quick and very easy. These vets in particular had never done a hernia surgery on a rat before, but they had plenty of experience doing other surgeries on rats, and they had done hernia surgeries on lots of other small animals. So they were very sure that this was going to be a very quick and easy surgery with very minimal risks. And indeed, it was very quick and easy, and Toast is recovering very rapidly. She has acted completely normal since the day I brought her home. The vets did keep her overnight for 24 hours just to make sure she wasn't picking at the site. However, after that, I brought her home, and she was acting completely normal. And from what I heard from the clinic, she was also acting completely normal pretty much as soon as she woke up. So everything went really well. Anyways, I just wanted to talk a little bit about umbilical hernias in rats because I haven't really seen a lot of information about them out there, and they are not super common, but they're also not super uncommon, so they're kind of something that just pops up every once in a while, and I don't see too much information out there about them, so I thought I'd just make a video on them to hopefully help someone out at some point. Basically, the gist of this is that you don't need to get them surgically repaired if they're small enough and they're not getting larger, and in any case, they often heal themselves, so you sometimes just need to wait if your rat is young enough. However, in the case that they are getting larger, or in the case that they are large and the rat is past the fast-growing stage, at that point, surgery is a good idea. And in any case, if you can get surgery done, that is the best way at preventing any future risks with these hernias, because once they're healed, that's it. You know, it's not going to impact impact their life later on. So just in general, it's a very easy fix, and while it is kind of pricey, this one cost around $400, a little bit less than that. I think it was like $373 or something like that. But anyways, it cost a fair amount, but you know, that just kind of comes with any surgery. Honestly, that's pretty good for my area. And the fact that the breeder is refunding me $100, you know, the rat's adoption fee, does definitely lessen the blow of that somewhat. Anyways, this video is kind of rambly, but I hope it helps anyone out there who's dealing with an umbilical hernia in their rats. It's definitely something I think worth getting looked at by your vet, regardless of if you're going to get it surgically fixed or not. Just because, well, any lumps in rats are kind of concerning, and it's good to get them checked out, regardless of what you think it is. Anyways, that's pretty much it for this video. Like I said, Toast is doing really well, and she's recovering quickly, so expect to see more of her soon. Okay, so that's it for this video, and I hope to see you guys later. Bye!